Okay. Yeah, the recording started now. Okay, we'll go ahead and get started. I'm sure there'll be others that will join as we go. But I wanted to start by allowing our Washington County staff to go ahead and come off of mute and just really briefly introduce themselves. If you want to just say your name and your role, I think that would be great. I'll go ahead and just start and say, I'm Bridget Monterossi. I'm the Senior Program Coordinator with the Communicable Disease Program. And Wendy, do you want to go next?
Sure. Hi, Wendy Taylor. I'm the Nursing Supervisor with Washington County's Communicable Disease and TB teams. And most recently, also absorbing our COVID team as well. So, and you'll get to meet all of them. But I'm very excited to be here, and thank you so much for taking time out of your Monday afternoon. I know Mondays are real busy, and I guess every day is busy. It's not just Mondays anymore. So thank you so much for being here. And maybe who do I see on my screen? Do you want me to pass it on to next person? Okay, I see Tyler Slattery right on the top of my screen there. Go for it, Tyler.
Yeah, thanks, Wendy. Hi, good afternoon, everyone. Tyler Slattery. I'm also a senior program coordinator with our COVID response team being absorbed into our CD team here. So I just help support our clinical team here. And let me see who else we have. I'll pass it on to Tisha.
Hi, good afternoon, everyone. I'm Tisha Anderson, nurse with Washington County. I was recently with just the COVID team, and I'm also being absorbed into the CD team as well. So learning the ropes. Thank you.
Okay. Sunhay, you want to go next?
Sure. My name is Songhae Boko. I'm one of the CD nurse. Good to see you, everybody. Pass to Jenny.
Hi, I'm Jenny or Jennifer Robertson. I'm one of the CD nurses with Washington County.
Awesome. And Trisha?
Hello, I'm Trisha. I'm one of the CD nurses with Washington County. Nice to see everyone.
Awesome. And Sue?
Hi, everyone. I'm Sue Young. I'm with Washington County. I'm one of the CD nurses previously in COVID, now transitioning back to CD.
Awesome. Thank you, everybody. I think that's all of our Washington County staff. And I also wanted to introduce Lisa Barton. Probably a lot of you know her and work with her regularly. She's an improvement advisor with Comagine Health. And so we're happy to have her here today. And I think she'll be really helpful, especially during the Q&A portion. So I'll go ahead and get started. As Wendy said, we're super happy to have you here today and happy to be able to provide this training. Our first speaker is Kara McGrill, and she holds degrees in human service, nonprofit management, and has received specialized training in music therapy and dementia care. After completing a program in gerontology with Metropolitan State University in Denver, she began serving on faculty as an instructor in aging leadership and health professions. Kara has worked across the long-term care continuum in adult day, in-home care, memory care, and nursing home care. She started volunteering with the Alzheimer's Association of Colorado and eventually served on staff as an early stage program coordinator, during which time she launched a statewide creative engagement program with museums, arts, and other cultural partners. She has also contributed as a writer to Activity Connections Dementia Programming publication for activity and programming professionals. She is honored to be serving in her current role as older adult behavioral health specialist with Washington County Disability, Aging, and Veteran Services. So please join me in welcoming Kara McGrill.
Thank you so much, Bridget. And hello to everyone out there. Today, we're going to be talking about burnout, compassion fatigue, moral distress, and some recovery tips. And this is a lot of content to be covering and not a lot of time. So I'm going to do my best. But what I really hope that you might get out of today is please contact me. I thought I had a slide for that. I'm going to put it up right away. Going to the very end. You get a sneak preview. Here we go. So this is me. You can get in touch with me via email or give me a call. I am part of Washington County Disability Aging Veteran Services. I'm part of a 2-person team that educates community, does workforce trainings. It's all for free. It's provided by the county. We are part of an initiative, a statewide initiative called the Older Adult Behavioral Health Initiative. So we might have already come to your facility and done some training with your folks, either on dementia or de-escalation or any other kind of behavioral health issues, mental health issues. But today, here we go, all the way back to the beginning, we are going to be talking about staff. So what is burnout? Burnout is a condition characterized by physical, mental, and emotional exhaustion. So basically, it's overload. And it's what happens when we neglect our own physiological, mental, emotional needs, probably, especially when we're in a care service like long-term care, we are neglecting ourselves over taking care of other people. And there's a few different relationships we're going to talk about today. One is how we're providing care directly to care recipients, people that are living in our care facilities and care homes, but also the relationship between leadership, staff, maybe higher levels of leadership. So there's all these relationships where this can apply, where we can feel burnout. What happens when we are burnt out? Well, there's 3 main negative psychological responses. One is depersonalization. So this means that we might not really even be seeing the people that we care for as people anymore. And I know that sounds extreme, and there's different levels to this. Or if we're talking about staff, we're not really seeing them as full people. We get kind of cold and depersonalized. So we start to see the people that we work with more as widgets than as full people. We also experience emotional exhaustion. So we just can't really, it's hard to care about things in the way that we used to, the way that we wanted to. And we might feel a lack of personal accomplishment. Maybe you're just showing up every day, you're going through the motions, but you're not really leaving that day feeling like something has changed, or that you being there has helped or made an impact or has been meaningful from someone else. So even though these things aren't true and aren't the way that we want them to be, this can result from feelings of burnout. So this is burnout takes us from the people that we want to be into somebody else that we probably don't recognize. And when I'm doing this training in other contexts, I always ask people to think about day 1 when you interviewed for this job that you're in. And think about when they asked you, why do you want to work here? What was your answer? What was your genuine response? And if we can think back to that person who was really, hopefully, really excited and anticipatory of maybe getting this job that you have wanted for maybe a long time, think about how that person relates to how you show up today now. Are they the same person, or have things changed? So think about that, and then also think about what keeps you going now. What is the thing that gets you up every day, gets you out of bed, and you're still showing up? Because let's face it, it's hard work, right? So what are the things that help keep you going? And I'm going to invite, I know we have a more intimate group today, which is totally fine, but if you are willing to do so, and even Washington County staff can do this too, what is it? Put it into the chat. What's something that gets you up in the morning, that keeps you going, that keeps you showing up to doing something that is challenging, hard, maybe a little bit on the path to being burnt out from? So what are those things? Put it into the chat if you can think about it. Let's look at stress versus burnout. So this is an important distinction. We're not talking about stress here, because stress is actually good as long as it's not overwhelming. So we need stress. We need stress to outrun that lion. Maybe it's an actual lion or a bear. We're physically in danger, or maybe it's more of an existential lion or something that's in our mind. But whatever that is, we need stress to get us going, to challenge us, to learn new things. So stress can be a good response. But if it's experienced throughout someone's day without the ability to recover from that stress, that's when it can lead to burnout. So some of the difference that you see is stress. You might experience emotions more strongly. Burnout, as we talked about, you might experience a flattening of emotions. So it's like, I don't really care either way, because you just feel like I have nothing left to care about this thing. Stress causes hyperactivity, so you got to really get going. You got to get moving. Burnout causes a helpless feeling. Stress, you have less energy, might be tired. Burnout, you have less motivation, hope, and you're experiencing chronic exhaustion. So these are just a few of the differences between stress and burnout. All right, so what causes burnout? Lack of control, lack of resources, not knowing what to do, dysfunctional work or home life, extremes of activity, so extremes highs and extreme lows, and a lack of social support. So think about where you work, the area that you work in. Why are long-term care communities at higher risk for burnout? And we know that they are. Really, anybody in the healthcare spectrum is going to be higher risk for burnout. So looking at this list here, why do you think that long-term care in particular is at higher risk for burnout? And you can go ahead and put that into the chat. If you think of your place of work and you identify with anything on this list, let us know what you think about that in the chat. So you might be thinking lack of control, especially for folks that are showing up and doing the direct care work. There's a lot that's out of your control there. A lack of resources. This one comes up a lot when we're working in healthcare, when we're working in personal direct service care, social services, mental health services. Lack of resources. We know what people need. We know what would help this situation, but we just don't have the resources to be able to do it. So a lot of things on this list can fall into that. So why does it matter? Why do we care about burnout, especially if we're wanting to support our teams? Well, if we're not well, we can't take care of others very well. And we say this for professional caregivers, but also for our family members as well. And I think most of us could nod our heads and probably agree with this. Yes, this makes sense. But the reality of the situation is that we often push ourselves to those extremes of just total exhaustion because we don't feel like we can take a break from caring for others. That depersonalization, like we talked about, can result in lack of meaningful connection with our loved ones, with the people that we take care of. So this can affect us at home as well. And burnout impairs our ability to provide safe, adequate, and supportive care. So we're just not going to be as optimal and as effective at our jobs when we're experiencing burnout as if we're taking good care of ourselves. So it really can impact the workplace. We know that there's higher turnover where there's more stress and more burnout. We know that there's more sick days. We know that there's more sick time, just staff working sick. So all these things can result as from burnout. I'm going to talk about two other things that kind of accompany burnout. So some of us might be familiar with this, but I'm wondering if you've ever heard of moral distress before. And I kind of alluded to this earlier. So moral distress is, as the worker, the ethically appropriate action to take, but you're unable to act upon it. You act in a manner that could be contrary to your personal values, and it undermines your integrity and authenticity. So what this means is, like I said, with resources, you might know that there is somebody who's at high risk for falls, and the best way to take care of that person is if they have a one-on-one companion. But we don't have resources for that in our care community. So we're going to just do the best and try to check in that person every time we walk by and hope that we might be there to help them. Or we might go to more extremes with that person and have to have a negotiated risk agreement with the family that they were just going to be more at risk for falls. Or we might try to manipulate their environment to a place where their freedom is compromised, but their fall risk might be addressed more. And those are all examples that might not align with our values as individual people, but we just don't feel like we have any better options to help someone, or we're just bound by the systems that we work in. So that's just one example. And you might think of others, of maybe even something that happened today where you felt like, I know what needs to happen here. And I bet your staff feel this way too. But because they have even less power and control, they're kind of bound by the systemic oppression of limited resources and things that we can actually do. Okay, and now we're going to talk about compassion fatigue. So compassion fatigue is a term that describes the physical, emotional, and psychological impact of helping others. So another way to say this that you might have heard of is secondary stress syndrome. So if somebody secondary traumatic stress syndrome. So somebody that is engaging in work that can be sometimes traumatic, where they are witnessing a death or a trauma or people in distress, which, think about the environments that we work in, probably check all of those boxes. We can be exposed to that vicarious trauma and carry that with us. So a lot of times people think, oh, long-term care, death and dying is normalized, right? It's kind of a normal day-to-day thing that can happen. Well, the problem with that is that we want to distinguish normalized versus minimized. And we want to make sure that we're still giving death and dying or something like that the weight that it deserves for the staff, for the families, for everyone that works there, for the other residents, without minimizing it. So we'll talk about that in just a moment. So how compassion fatigue, where does it show up for us in our care communities? If somebody is being physically or verbally threatened when providing care, if somebody's providing care to someone who is experiencing psychological distress, so they're just upset, if they're providing care in a dangerous environment, if they're providing care to someone at end of life or with a terminal illness, or if they're providing care under a heavy workload, excessive demands, or long hours. So again, thinking about our long-term care communities, how many of these boxes would we just check? Yes, this is every day. So what can we do? Like I said, we've got limited time today, so I hope that these ideas will just spark something for you. And please give me a call. Maybe I've already been out to your care community, which is great, but if we haven't, we have a team here who can come out. We can do some of these exercises that I'm going to talk about directly with your staff. What we usually do is we're educating on mental health issues, older adult mental health issues, but we can also do some of these staff resiliency building exercises in person as well. So what are the myths of recovery and wellness? So these are the myths. People think, oh, it is indulgent. It's selfish. I should just, power up and get through this. Myth is that you alone are responsible for taking care of you. I think we get this message a lot. It's very individualized, that you should be taking better care of yourself. You should be going on walks every day. You should be eating healthier. And we kind of forget that people's environment can really impact whether or not they're going to be successful in taking care of themselves. Another myth is that it's a one-time event or activity, like, oh, I had the annual staff retreat and we did yoga and now everyone's better, right? I've been invited into care communities where they've wanted me to come and present on something for an hour and like fix everything in that hour's time. Like, well, it doesn't really work like that. We have to look at systemic change and building habits and routine and a culture really that's going to support wellness and recovery. Another myth is you either have it together or you don't. That's a myth. And a lot of times people think that wellness is the absence of problems or change, but that's not true either. Resiliency is the ability to transform challenge and adversity into wisdom, insight, and compassion. So we have a resiliency toolkit. We're going to just talk about these first 3 R's with our limited time today. Return instead of react, release instead of relax, reframe instead of repress or play. So replay, that's what we're going to talk about just in our remaining couple of minutes here. So let's look at what we mean by return. So when we say return, if you are in a moment of stress, and this is something you can do for yourself or something better yet that we can build into our culture with our staff, we want to let people know that they can stop. Really, that's the most important thing, is when we're getting overwhelmed, is being able to recognize that and stopping, not pushing through it. I bought a bag of cough drops recently, and on each cough drop, it had a little message of go to work anyways, push through it, don't stop. And I was like, oh, what horrible messaging for a cough drop. It should say stay home and recover and take your time that you need. But in our society, we don't get those messages, right? We get the message that you just got to get it done and do it no matter what it takes, even at the expense of our own health and the care that we subsequently provide to others. So we stop, take a breath, ground into your senses, observe what you're thinking and feeling. So we really want to notice what's going on for me right now. And then don't proceed until we're proceeding with intention. So we want to prevent a reactive response and then work on a return to the body. So really just kind of rooting ourselves, taking a moment to just figure out what's happening with my body right now. The second one is release. So once we've noticed, once we can understand what's going on and we're ready to proceed with intention and not be reactive, we want to release that energy. So stress, remember at the beginning, I said stress is not necessarily a bad thing. It's actually something that's innate to being a human animal, and we've used it in positive ways. But the way that stress builds up in the body is that it increases hormones in our body that need to go somewhere. And what happens when we can lead to stress-related health issues is that stress, that those hormones in the body, that adrenaline has nowhere to go. We suppress it. So the most robust information that we have about this is really exercise. And I know a lot of people say, oh, exercise is so great, but what if we took that out from just being the individual's responsibility, you should get more exercise, and made a culture of stretches at every meeting. We're all going to start with a stretch. Or we're all gonna, for prizes at the staff meeting, we're gonna do a free day at the pool or something like that. So having a culture of getting outside, moving our bodies, understanding how important that is. And we know that the work in LTCs is very physical work. So how can we take that, knowing that, and say it's not enough? We need people to be using body movement, not just at work, but we want to be encouraging it as part of our culture of keeping well. So that's one way. Exercise is one way to release the energy, but also breathing exercises are good. Any kind of mind-body connection exercise, even gentle things like Tai Chi or yoga, those things are great too. And it's important to know these things don't work for everybody because we're all unique. Here's some examples on how we can, what it's called is completing the stress response cycle. So releasing that built up energy. lots of different things that we can do. Again, how can we build this into our culture? Not just hand this out and tell people they should do it, but how do we really build a culture of doing these things? The last one we're going to talk about today is reframing. And this is where your older adult behavioral health specialist team can really come in and help you. We love working with LTCs. We work across the care continuum, and they're really fun to come in and do these things. So remember, resiliency is not the absence of challenge, pain, or loss, but it's our ability to make meaning from those moments. So there's lots of research on how people can really endure challenging, hard things. And the thing that keeps us going is that meaning piece. Why am I here? Why am I doing it? If you are on the path to burnout and you just think, I don't care anymore, and all I see is widgets, that can be a really dangerous place. So we want to catch people before they get there, or hopefully maybe they're not even on that path, but before they get to that. And we want to kind of embed that meaning making into the work that we do. And here are some evidence-based ways that we can do it through gratitude. There's been a lot of work done for gratitude with nursing staff. Altruism, understanding that what they do is because they care about other people, and that's why they're here. Bridging differences, connection, compassion, diversity, empathy, forgiveness, happiness, finding purpose, and then also grief. So recognizing the fullness and wholeness of doing the work that we do and how grief and loss accompany that. So we don't want to ignore that and just go on about our day, but really experiencing the wholeness of that. So we have done, and we have programs on gratitude. There's a really wonderful evidence-based program on gratitude. We have compassion training, empathy training, and then we have fun little exercises for all of these. So I'd be happy to share resources for these if you wanted to just do it with your staff directly, or if you'd like some support and you'd like one of your specialists to come in, we'd be happy to come and talk to you about this. I'm just going to leave you with a quote from dear Jane Goodall. Hope is often misunderstood. People tend to think that it is simply passive wishful thinking. This is indeed the opposite of real hope, which requires action and engagement. All right, like I said, I know that was a quick one, but please reach out to me and I'd be happy to get you resources, talk through ideas if there's challenges that you're having, or come out and do a visit with your staff, either on a topic that we talked about today, or if you just would like some of those other educational topics, we'd be happy to come out for that as well. I'm going to stop sharing my screen. I think we might have a minute or two if there's a question or a comment from anyone.
I think we're just going to save the questions for the
Oh,
end.
that's
but
right.
I did notice that Amanda in the chat would like, I think she's referring to perhaps some of the resources. So Amanda, if I did put Kira's email in the chat, and she'll be available during the Q&A as well. So if you want to follow up with her, you can, and we can also address it a little bit more in the chat. But thank you so much, Kira. I mean, wonderful resource that you are providing in the community and to our partners. And so really appreciate your perspective here. And I know I personally also felt that I learned a lot and it was helpful. So thank you very much. Okay, I want to introduce our next speaker. She's from the Oregon Veterans Home, Ryan McKendry, and she's an LPN, and her title is Staff Development Coordinator. And Ryan, are there any other members of your staff that I should also introduce?
There are not. The other two that
Okay.
I thought were going to be joining me are not here.
Okay, that's fine. Well, we are really happy that you're able to join us, and Ryan's going to share some really good best practices that they've used in their facility. And yeah, we're excited to have you share your presentation. So go ahead.
Thank you. Sorry, I'm trying to open the PowerPoint here.
It's okay. Takes a minute sometimes. Yeah. You always have to, like, I think, open it before you can share it. Yeah.
Yeah. It's trying. It's just taking its time. Okay, can everybody see this, the first slide?
We can.
Okay. So at the Oregon Veterans Home, we've noticed lately that we had a lot of burnout. So we initiated a couple of things to try and connect more with our staff. So our first thing, we developed an employee appreciation committee, which meets monthly. We try to create a plan to show our staff that they're all appreciated and that we are happy for them being here and doing everything that they do. So a few examples of what we've done. I believe January or February was the first time that we started actually doing employee appreciation. So we did the little succulents with a thank you card in them that we handed out to all staff who were on shift. Back in March, we did shamrock shakes and we went house to house in our community, the Oregon Veterans Home, and we handed out shamrock shakes to all of the staff that were working on shift that day. And then we have a couple of things planned for this summer and fall. So in the summer, we're having a family barbecue. It's going to be on a Saturday, and we're going to have all of the staff and their families. It's going to be open to everybody, so they can come in and we'll have a barbecue, maybe play some baseball, just to get everybody together and connected. And then in the fall, we're going to have a chili cook-off, and we're going to we'll actually have like a plaque that we'll give out to the winner. So we try to keep everybody engaged as much as we can. For the holidays, we do a lot of friendly competition. We have 11 different houses in our neighborhoods. So we have 14 veterans, and then there's staff in those houses as well. So there are 11 houses with 14 veterans. And each of them does a Christmas tree every year. So we have a Christmas tree decorating competition. We do pumpkin decorating competitions. At the same time, we kind of do like a centerpiece. So sometimes we'll have Christmas centerpieces or Halloween centerpieces, and we'll use those in the houses when we have family visits for the holidays. And we try to get our staff engaged in that, but we try to get our veterans engaged in that as well. So we have extra prizes for veteran participation to see how many of our patients here we can get involved as well. This is one that's coming up actually next month. So for CNA week, we're doing some raffle baskets. So we have a bunch of cool baskets that we're raffling off to the CNAs that are here. And then one of our prizes that's also going to be raffled off is this coupon, which is a Pie Your Boss coupon. So at our next all-staff meeting in July, whoever wins the raffle for the coupons, which we're doing 5 of them, so there'll be 5 of our CNAs that are going to get to pie one of our bosses in the face, and they get to pick who they get to pie. So that's pretty cool to keep everybody engaged and hopefully get more people to come to our staff meetings as well. We use a platform here called Retain. I don't know, you guys may have heard of it. It's online surveys for our new hires and for our existing staff. Our new hires get a survey at 15, 30, 60, and 90 days of employment. It has questions like, how is your job going? Is there anything we can do to improve your situation? Would you recommend employment at the Veterans Home? We also have exit surveys that ask questions to our employees who are leaving us like, was there anything we could have done better? Why do you think most people that leave the Veterans Home, what was their reasoning? So maybe we can improve on some of that. And then for our senior staff, we have biannual engagement surveys. So a survey goes out with similar questions to our new hire surveys, but it It's anonymous, so it allows our staff out on the floor to communicate their issues and what they're seeing as honestly as possible because it's anonymous. And then we have a performance improvement team that has meetings after these biannual surveys to go over the results and to make sure that we follow up and everything gets implemented. And if any surveys come back less than satisfactory, I go out and I meet with that staff personally to discuss the reasoning for their negative survey or to see if there's any processes that we can improve. We also do an onboarding. So all new hires attend a 2-day training where management has the opportunity to introduce themselves and their department, and new staff learn about who to contact for which issues. And they're also given a facility tour. They get to see our central supply, they get to see our maintenance, and they get to connect openly with our management. Each manager gets an allotted amount of time where they're one-on-one with our new employees. So it opens those lines of communication from the very beginning. We recently, at the beginning of the year, I believe it was, started a Grand Rounds support team. This is one of my favorite things, along with the Employee Appreciation Committee, because again, it opens up those lines of communication. So our department heads, every day after our stand-up meeting, we make daily rounds in the houses to ensure that all equipment is functioning, staffing is appropriate. We didn't, somebody didn't call in and we didn't know about it, so we can switch staff around if needed. Making sure that all of their questions are answered, any clutter in the houses is managed, and any issues are taken care of in a timely manner. So we open up for our CNAs and our nurses, housekeeping, anybody who's working in that house that day. It gives them an opportunity just to let us know one-on-one what's going on and what we can improve. It keeps the lines of communication open, and it also keeps management in the loop with the direct care staff issues. So we have 11 houses on campus and we visit one house every day. So about every 11 days we cycle through and we've met with each house. And it just keeps going. So today we were over in Delta 1, tomorrow we'll be in Alpha 1. So everybody gets a chance about every week and a half to 2 weeks to talk to management directly. We have a staff development department. I'm the coordinator. I do mid-orientation check-ins with our new hires to discuss common issues such as care plan, location, login information, skills check sheets, and answer any questions that they have. So these common issues are things that we've noticed in the past that our new hires are having trouble keeping track of, where these things are located or who to contact when they're not sure. So we have an itinerary of topics to discuss when we go out and talk to the new staff that kind of lets us know who we're going to talk who they need to talk to about things. And it also establishes those lines of communication. We do biannual skills lab as well. So in January and July, we open these skills labs, which are conventions offered biannually consisting of several booths that test the skills and knowledge and allow management time to communicate updates and evaluate staff competencies. So in our activity room, we set up all these different stations and our staff get, they're kind of like bingo cards with all of the stations on it. And as they go through the stations, the person manning the station will check them off on their competencies. And so they kind of get to go through 12 to 16 stations, test their skills, and it also lets the managers let them know if anything has changed. So recently it went from, in Oregon, CNA 2s were the only ones allowed to help with blood sugars, and now our CNAs are allowed to do that as well. So that skills lab in January opened up those lines and let us communicate to our CNAs that there is a new process for that. We recently started up a mentor program. Caddy is our mentor program coordinator, and she pairs our new hires with trained mentors that will orient them. They do weekly check-ins for the first 2 weeks, then bi-weekly for 2 weeks, and then monthly until the new employee has reached their 6-month mark. And then the mentors are also available for questions at any time. And we get feedback from the mentor and the mentee to see if there's any way to improve the program. or if there's any commonalities that have been issues in the past between everybody that we can add to our training. We also have a CNA program. So OVHL has established a CNA program in-house. Students begin their training online, and then their clinical hours are completed on campus along with testing. The CNA class has improved our number of CNAs out on the floor, which has increased our staffing ratios and has boosted morale greatly. It's helped a lot with our staffing issues, so it kind of helps with that burnout issue as well. Our benefits also offer employee advantages. So we have a daycare reimbursement of $100 per month. So if you fill out a daycare reimbursement form and turn it in by the 5th of the month, I believe, they'll give you $100 extra on your check to help with childcare. Canopy offers our confidential mental health support, which is online, so you can get help. They have a certain number of visits per year. I can't remember what it is. And then we also have an employee assistance program. And our EAP through Canopy, it's a free and confidential service that can help staff, their dependents, or any household family member with any personal problems, large or small. It's confidential coaching or counseling that can be scheduled in person or over the phone. It can also be virtual, and they help with things such as stress and burnout, depression and anxiety, relationship or family issues, drug and alcohol use. And this benefit can also help locate resources related to issues such as child or elder care, identity theft, housing support, pet or parent support, legal consultation, financial coaching. It offers discounted gym memberships, half off on joining fees, and a 10% off monthly membership fee. So that kind of helps with the getting you moving part. And I think that is all I have.
Awesome. That was really great. Super
Thank you.
helpful. I'm going to go ahead and stop the recording.